Hello, my name is Sabrina Kurtz-Rossi, and I'm a newly appointed assistant professor in the Department of Public Health and Community Medicine here at Tufts. I'm also principal of Kurtz-Rossi and Associates, which is a woman-owned business. It's kind of offering health literacy education and evaluation services. I first got into the field of health literacy as a field of study and practice while I was at JSI World Education, which is an international public health and adult literacy organization. A lot of what I know about health literacy and have applied in my practice comes from international examples. Oh. Okay, there we go. The strong positive impact that education and literacy has on health is confirmed by repeated studies in developing countries and is supported by similar findings here in the United States. Maternal education levels correlate closely and is a very strong predictor of infant mortality, particularly death before age 2. And is perhaps the single most significant determinant of infant mortality. Also, in the countries that have the highest kind of rating for women's well-being and health, the literacy rate among females is 90% or greater. This is a picture from an eye health program in Mumbai, and here they're teaching the women in the community literacy skills, and the project is not only there to kind of support eye health in the community, but it's also providing literacy skills, economic development, nutrition. The idea is that they integrate both literacy gains, but also eye health information that women can then apply in their families and their communities. Now, it's clear that while education and literacy are important determinants of health, the idea of health literacy as a distinct concept is increasingly recognized as having a distinct influence on health outcomes. So, and that is exemplified. I give you one example that in Zimbabwe, also in Nigeria, during the HIV/AIDS epidemic in 2000. There was a very high rate of death among teachers with HIV/AIDS. So it kind of raised the example and indicates that general literacy is not necessarily associated with health literacy. And our understanding of health literacy really is being informed kind of from two sources. One, it comes from the merger of adult literacy theory with public health practice and the idea that and recognition that health information alone is really not enough, especially for disadvantaged communities. The other it comes from kind of a concern about high levels of low health literacy in the U.S. and in Europe, and the complexity of the healthcare system and the difficulty that folks that have fairly high education levels have navigating the healthcare system. So this is a picture of a meeting that took place and is sponsored by China, the World Health Organization, and the UN Economic and Social Commission for Asia and the Pacific. And one of the outcomes of this meeting was recognition among participants that health literacy is critical to increases in the effectiveness of health care programs and health care treatments. Now, the debate about what is literacy has long moved away from the idea of literacy as simply a concept of being able to read and write. It has increasingly being viewed as including a whole assortment of skills that allow people to actually function in their communities and in society. So taking a highly functional approach to health literacy is defined by the Department of Education in the U.S., the Institute of Medicine, and the Healthy People 2010, Department of Health and Human Services, as the ability to read, understand, and act on health information. So really applying reading and numeracy skills in a health context. Now, in 1992, the National Adult Literacy Survey conducted by the Department of Education and the National Center for Educational Statistics in the U.S., it was the first assessment of literacy in the U.S. They surveyed 26,000 adults 18 years and older. Each participant received a proficiency score based on commonly encountered literacy tasks and were then assigned a proficiency level. The NALS measured functional literacy, and it was the first study of its kind to provide a proficiency score. So instead of saying that people were reading at the 7th grade reading level or the 8th grade reading level or the 3rd grade reading grade level, it gave folks a proficiency score, so a functional literacy score. Folks in the public health field were really shocked by the results of that original survey that raised concerns about nearly half the adult population in the U.S. 47 to 51% of adults fell within the lowest two literacy proficiency levels at that time. Now, in 2003, there was a reassessment of literacy in the U.S. And at that time, the U.S. Department of Education and the U.S. Department of Health and Human Services collaborated to include 28 items that were designed to assess individuals' abilities to use print and written information associated with a wide range of health-related tasks. And this is a graph from that 2003 study reporting that only 12% of the adult population in the U.S., this is going to, scored in the highest level of proficiency. 77 million adults scored within the, which is about a third of adults, scored in the lowest two proficiency levels. Now, we have a fairly large 53% of adults scoring at the intermediate level. However, we really need to recognize that the health system really kind of expects and often assumes a fairly high level of literacy. And now, while health literacy may affect, all of us in some ways, literacy is contextual and is really associated with life experiences within context. So if you don't have an experience, say, well, let's give the example of somebody with diabetes who may have fairly low level of general literacy or health literacy. General literacy may be fairly highly literate in diabetes because they have been kind of involved in that context for many years, where someone with a new diagnosis would have fairly low health literacy level despite a higher level of education. Still, we do see that there are certain populations are disproportionately affected. So not surprising, let's go with this one. Adults with less than a high school education are were disproportionately represented among those with below basic health literacy scores. And also adults that are 65 years and older, just to think about who is particularly at risk. Among adults 65 years and older, only 3% of adults score within the proficient health literacy level. Okay. We also have a growing body of evidence in this kind of new and emerging field of health literacy about the link between health literacy levels and health outcomes. So we see underutilization of services. Let's say women with lower health literacy scores are less likely to have mammograms and pap tests as compared to women with higher health literacy scores. Kalikman in 2000 showed that those with lower health literacy scores demonstrated poorer knowledge of their HIV/AIDS status as compared to those with higher health literacy scores, and that was regardless of educational level. We also see patients have poorer disease management among diabetes patients, among those that have lower health literacy as compared to higher health literacy, and then, of course, costs. It's estimated that $238 billion a year is as a result lost due to misunderstanding and low health literacy in the healthcare system in the U.S. Now, there are folks that, particularly thinking about the World Health Organization regional office in Europe, just recently in 2013 came out with a report that called for an expanded definition of health literacy that really looks at health literacy being considered as both an individual level health literacy challenge as well as a systems health literacy challenge, and that the complexity of the system is something that needs to be considered when we think about trying to address health literacy. Increasingly, we're looking at interventions that try to raise the health literacy of individuals, families, and communities, but also try to raise the health literacy of healthcare professionals and healthcare systems. So what I'd like to do here is to present a couple of examples, or actually 3 approaches to addressing the health literacy challenge. One takes a patient-centered approach and really looks at the patient-provider communication. And this is the first example. So this is a patient-centered approach. It's really taking into consideration, looking at what's called plain language. And in the workshop that's going to take place after this morning's session, those folks who are interested in participating, we're really going to look much more closely at these 3 approaches: a patient-centered approach, an audience-centered approach, and a learner-centered approach. But I'm just going to kind of introduce those 3 approaches now. And again, this is the first approach, looking at a patient-provider communication. It's really well exemplified by this very short video, a poem by Elizabeth Murray. So let's see if we can kind of get the video. I think I might need Ludan, perhaps, to help me out here, but maybe not. Okay, I would just think it really raises the issue that health professionals and public health professionals need to recognize that every encounter is a cross-cultural experience, that we have our own language and we have our own culture, and that everyone it will benefit from plain language. Research shows that both those folks with strong reading skills as well as those emerging readers prefer plain language. Plain language is a strategic response, and it's a key part of the solution. So in the afternoon, we're going to talk about plain language, avoiding jargon, how to train, what we can do to train health professionals, clinicians, and public health professionals, but also this evidence-based approach, which some of you may be familiar with, which is a teach-back. Related to kind of how you can check for understanding and then do some reteaching. So that's kind of a teaser for the afternoon. The second example is what I called an audience-centered approach. Just providing information in plain language is still, not enough. What we need to do is provide tailored information. This is coming out of kind of marketing and what we in communication call social marketing, and really understanding the needs of your audience, understanding their belief systems, the knowledge, perceptions, where they get information, how they value information, what channels of information that they prefer. So this is an example that comes out of California. It's a collaboration between, I think it's called Youth Speak, and the University of California in San Francisco Health Disparities Center. But let's just take a look at it. It's related to diabetes and really engaging youth in developing messages for and by youth. Okay. My final example is what I call a learner-centered approach. And what I would like to do is hold this video off for the afternoon. Educational interventions play a critical role and a central role in promoting and strengthening health literacy, and participatory approaches are especially promising. So this is an example that takes place in Peru. It is a health literacy intervention that looks at using media and plays to kind of promote health within the community, again in Peru. One of my questions for the afternoon or for discussion, or there are actually three. One is, how do we increase the health literacy of individuals, families, and communities, and how do we kind of adapt various approaches to different contexts, global contexts? How do we improve the health literacy of professionals and systems? But lastly, how do we promote collaboration, international collaborations, collaborations across disciplines, and again, how to kind of adapt these various approaches to different contexts. So I hope you'll join me in the afternoon for a continued discussion. Thank you.